Assalamu alaikum ladies, how are you? I hope you are all doing really well, inshallah. I'm starting a new series of videos on my channel. Those of you who follow me on Facebook or on Instagram, I've already given you a message about it. It's called Girl Talk, and in my first episode I am joined by Dr. Farah Ahmed.
Assalamu alaikum.
Wa alaikum assalam, Farah. Farah is a London-based GP. Yes, indeed, she is quite awesome. And she also happens to be the UK spokeswoman for Boots WebMD. Welcome.
Thank you for having me.
Welcome to my humble abode here.
And what a nice humble abode it is.
Thank you very much. Well, Farah, today I wanted to talk about quite a serious issue actually. And it's about something that affects a lot of women in the UK, and that is breast cancer. Let's start off then by talking about why it's important that we're aware of breast cancer.
Well, as you mentioned just now, Amna, breast cancer is now the UK's second biggest cancer, second to lung cancer. There are roughly 500,000 people living with a diagnosis of breast cancer, and every year 55,000 new people are diagnosed. So just to put that into context, that's approximately one person every 10 minutes who's diagnosed with breast cancer.
That is insane. I did not know the figure was that high.
It's staggeringly high, and to put it another way, there are two of us sat here today. Say we invited 6 more of our friends to join us for coffee. One of our little group of 8 would be diagnosed with breast cancer at some point in our lives. So 1 in 8, I think it's quite scarily high.
That is. What is breast cancer? Tell us a little bit about the disease itself.
Cancer is a disease. It's a condition which is defined by the presence of abnormal cells present within the breast tissue that are dividing and replicating very quickly. The cancer can spread via the bloodstream or the lymphatic system to other organs, and that's where secondary spread to other organs occurs. And the prognosis for people with secondary spread is pretty poor, so the key is to detect it very early, as early as possible.
What puts women more at risk of having breast cancer?
There are 3 main risk factors. Unfortunately, they are irreversible, so we can't really do anything to reverse them. One is age. Breast cancer is the single biggest killer in women aged between the age of 35 and 55, and as one gets older, the risk of breast cancer increases. So, daisies who are in their late 20s, their risk of breast cancer will be around about 1 in 2,000. As they enter the late 30s, it increases to 1 in 200. Mid 40s, it's around about 1 in 50, and it just rises as you get older. Exactly, yeah.
So if there is a viewer who's watching concerned about perhaps presenting with some of the symptoms, and she is in her 20s, should she brush it off, or what do you think we should do if we are in one of the low risk categories?
The key is, first of all, not to panic, and there are lots of drives from breast cancer charities and GPs to educate people and make them breast aware. Now, this is essentially teaching women how to examine their breasts and what to be aware of, what's normal for them, what isn't, and when to present to your GP.
So what are the symptoms that we should look out for? What should sort of raise some red flags and give us that push to see the GP?
So things that we worry about are, first of all, if you notice a lump or a thickening in any part of your breast, see your GP. If you notice some nipple changes, if you find that the nipple becomes inverted, which means to be pulled in, again, seek help. If there are changes in the skin texture with some dimpling, see your GP. If there's any nipple discharge, if there's a rash or redness around the nipple area that doesn't disappear, or if there's any swelling underneath the armpit, then again, seek professional help.
Often we associate the presence of a lump with breast cancer. What kind of a lump does it have to be a really big lump, or
no? I think some women naturally have what we call lumpy breasts, but if you find a discrete lump that fails to disappear or it grows in size and you think that that's not normal for your body, then see your GP.
So we should know our bodies.
Absolutely, that is key. Just knowing, it may be normal for person A to have lumpy breasts and person B not to, but whatever it is deviates from the norm for you, seek help.
I think sometimes as we get swept up in the day-to-day busyness of life, we forget to be body aware. We should know what our bodies are like. We should be breast aware. How often should we examine ourselves?
So the breast tissue can change throughout your menstrual cycle. So your breasts may be very different at the start of your cycle compared to midway through the cycle. So the key is to examine your breasts at various times in the cycle, so you recognise what's abnormal and what isn't. Also, things like pregnancy and approaching the menopause can alter the shape and texture of the breasts as well. So as long as I'd say if you've never examined your breasts at all, then maybe examine them at various times throughout your cycle for the first couple of months, so you're really confident in knowing what's normal for you. And then after that, perhaps once or twice a month.
And what if we find that some of those symptoms are present? What's the first stage of seeking help?
So the first stage of seeking help is by attending your GP. So first of all, they'll want to take a history, so to understand what's been going on, what's prompted you to see the GP. After that, they will examine you, and based on the history and examination, they will either refer you to the breast clinic, refer you for an ultrasound scan if you're under the age of 40, or a mammogram if you're over that age, or they may just want to see you again in a couple of weeks' time to see whether or not the lump is still there.
We want Farah to be our GP. Isn't she lovely, ladies? I love my GP as well, but kind of want Farah, don't we? Should we kidnap her? Lock her up in this room. No, thank you so much for joining us today, Farah. Just before we finish off, I want to ask you what you would recommend for those who may not be suffering from breast cancer or presenting with any of these symptoms. What can we do to help those who are suffering from breast cancer?
Well, there are lots of brilliant charities doing amazing work. Fundraising would be a great idea to further research and also to help people that are already diagnosed with breast cancer. So it's all about raising awareness.
Cool, and inshallah this video will do a little bit of that today.
Inshallah.
So thank you guys so much for watching. Please like, comment below with any extra words of advice or anything that you can offer to add to this topic. Please share this video because you may not be suffering from any of the symptoms yourself, but perhaps you could help to raise the awareness for somebody else that you might know, a friend or a family member.
Yeah, absolutely.
Knowledge is power. I shall catch you soon. Toodles. I'll go like this.
I want to wait in the car, yeah? Alright. Hello?
We're doing a thumbnail, babe. Is that hello?